Welcome, everyone. Happy Friday. I am so excited for this discussion. I have a new best friend as of 5 minutes ago, John Hoffman, Senior Director of State Policy and Advocacy with the American Kidney Fund. We've got a lot to learn about from John, but let me just do a few shout outs about upcoming meetings. Next Friday, we will be together for our monthly meeting. It's from 11 to 1. Our friend Mike Kondratik, who is on right now, our friend Lee Dobson, who's on right now, will be presenting the art and science of effective advocacy. It is part 3 of our Advocacy 101 series that we started a year ago. So they, in combination with John, will make us effective advocates. And I appreciate all that they are teaching us to do. So thank you. And then Friday, March 22nd, Connie Bonebreak will be our host, for Friday Facts. We'll be interviewing Judith Brown from Project 70 Forward. So we've got some neat things happening in March. So with that, I am letting people in and I am excited to turn it over to John Hoffman. I told John, you all know, rather than saying I research guests, I stalk guests and find out fun things about them. So John is, well, things that they've put online, so it's not too bad. But as I said, John is the Senior Director of State Policy and Advocacy with we're getting a good crowd, with the American Kidney Fund. As the Senior Director of State Policy and Advocacy at American Kidney Fund, John leads a team of professionals who work to advance the interests and rights of kidney patients and donors across the country. John has over 10 years of experience in advocacy, government relations, and policy, with a focus on health and economic issues. John is passionate about developing and implementing effective advocacy strategies that leverage grassroots engagement and direct lobbying, legislative analysis, and technological innovation. I think it's really clear already why he's connected with us here at the NC Serious Illness Coalition. But welcome, John Hoffman.
Thank you very much. I appreciate it.
Yeah, and how appropriate. Thank you, Mike, for introducing us to John, and so appropriate. It is March's Kidney Action Month, so it seemed perfectly appropriate and great timing to talk with you. We want to learn all about the American Kidney Fund and some of your key initiatives, especially as it relates to legislative initiatives here in North Carolina. But as we always do on Friday Facts, we like to learn a little bit about our guests. So tell us about you and where you're from and what brought you into advocacy work.
Sure. Again, thank you for the invitation. I'm from Virginia, not born here, but raised here since I've been 5. And I went to school here, and I love the state. I love the area. I have been interested in sort of the political science space through college and didn't really know what that was going to look like. I went to grad school and I said, I'm really interested in international economics. And then I got out and the global economy crashed. And there was not a lot of interest in sort of international economics and trade around that time. So I pivoted to health, considering there would always be an opportunity in that without a real passion. But
Always.
I've not been able to get out. I love patient advocacy. I've done every single job in my career so far. I anticipate it will continue to stay that way. So as you said, over 10 years at different patient advocacy organizations doing different kinds of things, but all sort of focused on patient advocacy, trying to break down barriers for people to get affordable access to treatment and make sure that they're able to live happy, healthy lives as long as possible. So it was not my stated goal at the onset of my career, but I think everybody on this call and anyone who listens to this in the future know that it's sort of a winding road from what you think you're going to do to what you end up doing, and then even then sometimes you'll do something else afterwards. So
Yeah,
it's a
it becomes a calling. And I did see there's a lovely through line. I saw you were at the Leukemia and Lymphoma Society. As I look through it, there definitely is this connection in the health space and helping to raise voices together and bring about change in a space, especially the political advocacy space, that gets a little complicated.
It does. I think another common through point, and I think maybe what's gotten me hooked, is the way that I always tell people how I evaluate the job that I'm doing. I mean, once you get into state lobbying and lobbying in general, you can look at your scorecard as bills passed, and that's one way. But that's more rare, and sometimes not sometimes, most times it's out of your control how those things go. But for
Yes.
me, it's looking at the number of people who come into contact with me or my organization that are afraid to lobby, who have never done it before, who are sometimes being coaxed into doing it for the first time and maybe are afraid, and then seeing how many times they come back. And if I see someone that didn't want to do it really that much, or was afraid, or didn't think they have an impact on anything, and then
Mhm.
they become a lifelong advocate and one of the people that you have to that you just know will show up whenever you call, that's how I view success. So it's growing that group of people who realize the power of their own story, realize the ability of an individual to make an impact, and then just it becomes their second job. That's how I so anytime I do that, anytime I meet someone like that down the line, and I've met now a couple people, dozens of people over the years where that's been the case, I think this is the job for me. This is what I like doing.
Oh, that's wonderful. And it's so appropriate for us here with the North Carolina Serious Illness Coalition because we really are trying to. Our symposium was literally called Joining Our Voices. How do we bring our voices together? I know I have been, as much as I'm chatty, I have been a reluctant advocate in our General Assembly or in DC, and yet I've done it quite a bit. Well, in that I've done it like 3 or 4 times in the past year versus nothing. Because you do get, even those of us that are comfortable talking and sharing our story, wonder, will it really make a difference? Um,
For,
so
for sure. That's the overcoming that. I think there is a built-in, particularly maybe at the federal level, where the reputation of things is that nothing gets done and there's just no way to impact, and it's all about lobbyists and money. But I think, that I don't necessarily agree with that. But at the state level too, the connection between you and your state legislator is so much closer. They're typically working in your community. I know a lot of places have part-time legislators. So I know that the legislator in my area is also a real estate agent. They're in your community. Their kids are in your school. They don't have access to special knowledge or skills that you don't have. So when you're telling them something that's affecting you and your community, they're likely to know it and experience it and be able to, realize that they needed to act on it. So I think
oh, true. I saw one of our local legislators, our state legislators that I lobbied in Raleigh, where we have, and I saw him at a restaurant last week, and he recognized me, and I because I recognized him, and I was like, he knows me. And
politicians very good at that. That is a very good skill for them to have, and it's good that, to your point, it makes you feel like, all right, well, that was not time wasted. Like I
yeah,
made some sort of an impact.
I introduced myself from the Serious Illness Coalition. He's like, I know who you are, and I was like, whoa, okay, well then let is it awkward then? You're at your restaurant, okay. So you've gotten us, and I'm so glad that you did mention this the scorecard as not being about bills passed. I mean, we advocate here in North Carolina for a number of issues, but there's like one little bill, like oh, I don't want to call this little bill, and we can't seem to get it passed. And so that's what I do struggle with lobbying work is that when you look at what is success, but it may have nothing to do with the amount of effort. I mean, I like tangible success. If I do something and then here this was created, this bill, it kind of goes to the political whims and wins of other
Sure.
folks. So tell us about the work at the American Kidney Fund and how you don't get discouraged by what I get discouraged about this sort of changing political whims and wins, as I like to call it.
No, I think very natural to be discouraged by that. I don't think that's not a unique trait. I think it's perspective is helpful. I think it's also helpful that we cover 50 states, so I can't get too down about any one state giving me problems. So that's helpful, I guess, in that way. But I'll back up a little bit. So the American Kidney Fund has been around for quite some time. In 1971, we were founded, where the reasoning was that a group of neighbors were trying to get together to pool money to help pay for dialysis for folks. Dialysis is a extremely expensive procedure. It was even more so in the 1970s, but even still that persists. And they were able to pay for 79 patients to get life-saving treatment. And that's where American Kidney Fund came from. And we have expanded from that, obviously, to now where we have many programs from an educational perspective, research where we fund research fellows in clinical nephrology, and then the advocacy work, which I'm most acquainted with. We are busy at the federal and state level, working on a host of issues. And it's funny that I mentioned we don't keep that the scorecard is not really kept, but
Yeah,
it's funny because one of our largest things is a scorecard. So
I was
it's
like, let's go segue to that because I know that was one of the things neither of us caught that. And it's like, oh, wait, you're
Yeah.
supposed to tell us about the Living Donor Scorecard program.
I've been told 100 times to call it the report card. So because that is
Oh,
in fact true, I will say that I did not. My point stands. I don't keep a scorecard, but I do
all
keep
right,
a report
Living
card.
Donor Report Card program. So how does that link in with the American Kidneys Fund's initiatives?
So we have been trying to figure out a way since 2021. The work precedes this, but since 2021, how do we tell the story about progress over time? And how do we look at the bucket of issues that we focus on, which is mostly about how do we improve the regulatory or financial climate for someone who wants to become a living organ donor? How do we
Mhm.
clear barriers from someone who has been educated, who has been passionate enough, which is another whole thing, but they're there. How do we make sure that there's nothing that dissuades them from following through that process? Because the number of people who need a transplant is substantially by multiples level higher than the people who are willing to do so. So this project since 2021, which has been more successful than I would have assumed coming in, measures 7 different legislative buckets across the country, and we give points for each one that's been passed. We could send those around afterwards or make sure we have a link, but there are 7 bucketed pieces of legislation, and I'll start with sort of North Carolina. Do you want me to walk through all these? There's 7 of them. I don't think it shouldn't take too much
Yeah,
time.
you can do it. And that's and listeners, if you haven't already caught that, John is a national focus, but he is able to bring the North Carolina perspective, which is how he's joining us. So yeah, if you can go through what the North Carolina issues are, that'd be helpful for us to know.
Sure. So I will start with the grade. So North Carolina's grade is a D, which is not
Uh,
not where you like to be, but I will give you hope in that Michigan was an F last year, and we have been working there, and it is a C now, and it's on the edge of becoming a B. So immediate, speedy progress is possible. But I'll talk about what makes that grade up and how you get there. So again, I mentioned there are 7 buckets of legislation that we focus on that will improve the climate for potential living organ donors. And I'll start with the ones that are not pending. So I'll end with the one that is actually a bill that you can work on in this short session coming up.
okay.
So job protected leave is important for someone who who wants to become a donor. Oftentimes we hear from people who said, I found a match. They went through the process. They were really excited to do it. They asked their employer if they could have some time off to recover because it takes a little bit of time to recover, not a very long time, but some amount of time. And they work at a job that doesn't provide any sort of leave, no paid leave or unpaid leave, saying if you leave, I have to replace you and your job is gone. So many states have passed legislation that provide you at least job protected unpaid leave. So for some amount of time, it varies state by state. If you leave, you come back, your job is there waiting for you. You're not going to be replaced, which is important for some kind of job. That's a big. You're
Yeah,
you're willing to give of yourself for sure, but I think that people should not be forced to put their personal economic future in jeopardy for doing so. And this is an easy way to do that.
yeah, it's so basic, but you can't believe you need a bill for that. But go on. All right. Yeah.
So the other sort of component of that is for public sector employees, sort of the same issue. That's not a given either. That if someone who works for the state wanted to do that, that's a bill that many states have passed. Some states pass it by just regulatory change. It passed last year in Michigan, just by decree, basically. So that's great. That saves us work on that end. Though one of the ones that I'm working on this session in a bunch of different states that is the most politically challenging one to pass is tax credits for employers who provide paid leave. So the idea there is unpaid leave is great. Making sure that your job is still there while you leave and come back is great. But it would be a lot better if I could give this organ and make sure that I am going to be covered financially as well, that I'm not going to be worrying about bills if it potentially takes me longer than the normal amount of time to recover. I think that we all understand sort of the financial precarity that a lot of people live under, and that having no paycheck for 2 weeks, 3 weeks, a month can
Sure.
cause major ramifications for people.
Yeah.
So this bill, as it's built in a lot of different places, again, all these vary. There's flavors of every one of these. It all sort of depends on the political environment of the state you live in. But the idea is that if an employer is willing to do this, give this benefit to his employees, they get a tax credit from 30 to 100% of the cost of those wages for that individual while they're gone. And they also, in some states, get money to pay a replacement worker for a certain amount of time. So if it's a type of job where it's such a small business that it cannot function without that person, they're able to sort of hire a temporary worker in that way.
Great. And this is different than that. Well, that's the paid. I was even thinking with the job protected leave, if it was for a family member that you're donor, like the FMLA is not really meant for that unless, right? Because that's about caregiving and,
Right.
okay. And
It's considered like a voluntary medical procedure, which is why it's exempt from that
it
from
doesn't
that.
fall in. And also if the organization is less than what, 30 or 50 people. Okay.
Mhm.
All right. So then that's the third. I'm taking notes here. All right. Job
Great.
protected leave, public sector employees protection, tax credit for employees paid leave. See, I'm paying attention, John.
That's
And
great.
listeners, feel free if you have questions. I know we didn't do the put in the chat line if you have any questions for John, that'd be great too. All right, go forth.
Next one would be direct reimbursements, tax credits, or tax deduction for donor expenses. So when you when you decide to become an organ donor, all of your medical costs associated with that are covered by the insurance of the person receiving the organ. So all of those costs are covered. That's fine. However, there are a number of costs that you accrue in that process, going to get tested and make sure that you're eligible, make transportation costs. Usually you don't donate in the city you live. You could be traveling across the state, depending on how big your state is. It may not be a day trip. So hotels, parking at the hospital, lost wages, childcare expenses. There's lots of things that add up over that time period, because it's not just the procedure and the recovery. It's all of the process of going to the hospital and getting all those genetic and physical tests run down, and the assessments to make sure that you're an eligible fit for that donor. So that is a thing. Usually the amount is $10,000. There have been a number of studies that sort of find the range of what those costs accrue to. It's between like $5,000 and $13,000 is what the most recent study says, the cost that someone accrues. So the idea is you provide a $10,000 tax credit that someone can keep all of their receipts and apply at the end of the year to make sure that they get that money back on what they owe the state.
Wow. I always thought it was the most generous thing, donating your kidney. I didn't realize there's another 10,000 on top of it that you're donating with all of the process. No idea. Okay.
It shapes the population of people who are able to participate, right?
Yes.
If you're making all of these financial burdens, some people with certain types of work say, "Oh yeah, I've got really generous leave
Mhm.
and I don't really worry about missing a paycheck. It'll be fine, and I have family that I can stay with wherever." That's not everybody. That's not most people. So I think it really changes who is in the marketplace, so to speak, to do such a thing, to be generous in that way. So
Wow. Okay.
these measures sort of open the doors to people who would, who have altruism in their heart to do that, to make sure that they're not kept from doing that from, material reasons or job
Cool.
related reasons.
Oh gosh. Okay. So then that's the fourth one, the direct reimbursement for
The
donor expenses. Okay.
the other two are sort of related, and this is depending by state. Uh, One of them is paid leave by a family and medical leave state law. So we've already talked about federal FMLA and how that doesn't fit. There are many states, not enough of them, that have paid family leave programs in their state.
Mm-hmm.
Oftentimes, living organ donation is not considered one of the conditions that you could claim for it. So we have a
Oh.
few a few states this year where that is being added. It's basically, typically it gets built, the system gets built out. There are many other conditions or reasons and people
Mhm.
lobbying to form that bill. I like to wait, let that happen. I would, I'm happy to throw our weight in as well, but our weight isn't quite as heavy as other groups that are on that. And then we typically go back and try to fix after the fact, saying, this is a very small population. In your state last year, we'll say 145 people were living organ donors. So
Mhm.
if we're talking about every single one of those people being in a position to take advantage of this, the cost would be de minimis. That's like the story for most of our bills, unfortunately, because living organ donation is still so increasingly rare. As we try to get protections for those people, from a budgetary perspective, it's a very small impact compared to sort of larger health
Fun
conditions.
word. I don't know if I've heard, but de minimis? De minimis?
Yeah, we use that a lot. It's just a very small, almost
Mike
insignificant
is
financial
laughing at
impact.
me because he knows this word, but what is that what it is? De minimis? Okay. And it just means like a tiny little amount.
Almost unnoticeable, I think, is like
Diminishing. It must be connected Latinly. Okay.
I figure on a Friday morning, why don't we want to throw in some esoteric Latin phrases to make us all feel good
He
in the
needs
morning?
to. All
Happy
right.
to.
So then there's the paid family leave, and then was there, I feel like there's one more.
Well, more than 60 days. It's just the number of days available for that. So one is that you're eligible, and then two, the amount of days possible. That one's less frequent. But I wanted to wrap up on the one that is actually going on in the state when something you can get involved in.
Yes.
So this one I think is the most shocking to people that it's able to happen.
Okay, I'm prepared.
All right. So if you are in North Carolina, if you are a living organ donor or want to become one,
Hmm.
your insurance, life insurance, disability insurance, long-term care insurance provider, should you have them, there is no restriction on them saying your rate is 300% or 400% or 1,000% more than it would be if you were not an organ donor. So they can discriminate against you
Oh,
based on your
yeah.
status of being an organ donor. Yes.
Oh,
So
the whole medical underwriting, it then becomes a big mark.
and
That's
the
your last
wild thing is
organ.
the wild thing is there's no medical evidence to the effect that that is valid, right? There's no, if it's something is not regulated, it's not restricted, right? So any insurance provider can say that they've done, their actuarial table says that this is a risk that we're not willing to write, but they're basing it on information that has no basis in science. The kidney is the one organ in which you have a spare on you, that your numbers, should you donate, are the same before and as the same as they are after. Your life is, if you're a healthy individual and you're able, and if you're donating an organ, you're a healthy individual. If you were running marathons before and rock climbing and you're doing all those things afterwards, your life is not affected in that way. So there is no medical basis for charging a higher rate for someone who does that. But because there's no restriction in place, they can and they do. So 32 states across the country have already passed legislation to prohibit this. North Carolina has a bill. The bill number is
Yes,
HBH 162. It,
H162.
sponsored by Representative Shepard in the House. So this bill has passed the House. It got through, I believe, unanimously. I don't have the vote in front of me, but I think that was correct. And it is now stuck in the Senate, and it's been there since last year.
Where's it stuck? We've got a bill stuck in the Senate. Where is it stuck?
And it might be for the same reason. I'm not sure. It's right now in just the Rules Committee, so it hasn't even really moved forward. From our
But
understanding,
our goal is to get some bills out of the Rules Committee. That is where ours is stuck as well. Is it
right?
stuck? It's just sort of there.
Well, I don't. I think that we're
We'll
caught up
talk
in some.
offline when we're not recorded.
Sure, yeah. I think there are things at play that have nothing to do with our bill that are keeping them there. So it'll be interesting to see how much uh just the general shift of the session moves these bills that are stuck versus anything it's not about the individual merits of the bill. There's not a pushback about this. The thing that's really notable about this legislation is that I have worked on it now. I've been here for almost 2 years. I guess in August it'll be 2 years. I've worked on this bill in 4 different states. I have never, well, more than that, sorry, six, probably six. I've encountered no opposition to this bill. I've encountered no life insurers who are willing to testify and say that this is bad for my business and I should be able to write plans however I like. The National Council of Life Insurers supports the national federal version of this bill and supports every single state version of this bill. So it is solely a matter of prioritization, and it's solely about understanding. These bills all go to insurance committees. So it's all about imparting on the chair of these of insurance committees, which are typically very experienced in the insurance space, that this is a serious problem. It's happening in your state. It's happening across the country. Even if it's not happening in the thousands, if it's happening in the low numbers, it's
Yeah.
still impacting people's lives in ways that no one is saying should happen. It's
Mhm.
keeping people from becoming organ donors, and this is the lowest threshold thing you can do because it doesn't cost the state any money. There's
Yeah.
no political opposition to it. So it's really a no cost bill to pass in any single way from a political or a financial way. It's just about getting to the top of the heap.
Yeah, because it's not stuck in the insurance committee, it's stuck in the rules. So did it already go through the insurance committee? Like, did they already bless it to even get it? Like, this is how I don't know how the sausage is made. Like, did the insurance committee already weigh in and say this is fine and now it's stuck in rules, or does it have to get out of rules to go to insurance?
I believe it. So if it follows the House process went, Committee on Health reported favorably, recommitted to Finance reported favorably, floor vote.
Yeah.
I'm not sure on the Senate side what the process is going to be. So
Yeah.
I, I've been told to talk to leadership on the Senate side to talk about the issue and try to answer any questions around it. But I honestly do think that it is largely a systemic issue rather than the bill issue. That doesn't mean I'm not going to push it. I'm going to probably be down in North Carolina next or soon to try to have those conversations. But
well, and hopefully we can see each other. And we have a few minutes left, but a comment came in on the chat line. Thank you, Mary Bethel. Perhaps the coalition should support this legislation. I agree, and it actually adds to one of my other questions, which is how can members of the coalition better advocate for individuals living with kidney disease? We are the Serious Illness Coalition, and we do have legislative priorities. The bill number is, yes, H 162 is being asked. So how can we as a coalition here in North Carolina help to advance your efforts and perhaps the other way around if we have things? Like, how can we work together?
I think that's a great question. I think that this bill that has not passed is usually the first thing we try to pass. I think it creates a floor of understanding and it makes people have conversations about living organ donation. So I think that, efforts, anything we can do as a group to sort of either have this in a bucket of bills that make common sense, that are not, usually non-controversial, bipartisan. That's the other thing about this issue and almost all of our issues. It makes almost no difference which party is in control of the legislature. We have sponsors of both parties. All of our issues are nonpartisan, which is honestly I've been doing this now that is the way I prefer to work, and it is the way to work most quickly. So that is the case here again. I think it's about sort of being aware of the scope of the problem in North Carolina. So there's 27,000 North Carolinians with kidney failure, and 19,000 of them are, almost 20,000 of them are on dialysis, and 7,000 of them have received a kidney transplant. The number of North Carolinians with kidney failure has increased by 40% since 2010. So it's a serious and growing problem. 1 in 4 North Carolinians are on the transplant waiting list, have received a kidney. That number is actually better than most.
Wait,
You have a
so because right now, if I have those numbers right, 20,000 people are on dialysis, which means, and many of them, or are those, does that mean that's 20? That doesn't mean 20,000 are waiting for an organ because there's an eligibility something.
eligibility, health issues. I think the one issue I didn't talk about is Medigap, which is extremely important to that sort of transplant. I'll give a very, I know we're short on time. I'll get a 30-second version of that. So if you're under 65, the only 2 conditions in which you can be eligible for Medicare early are end-stage renal disease, kidney disease, and ALS. That's great because it covers 80% of your out-of-pocket, but it doesn't cover that 20%. Usually when you're on dialysis, or often when you're on dialysis, you're unable to work because of the severe toll it takes in your body and time, which means that you are spending down your assets. If you're alone, or if your family, or if you were the major income provider, you're spending down your assets to nothing. And then you're going on state Medicaid. The state Medicaid picks up that 20%. And that's how you're eligible to get a transplant. So on that way down, if you need secondary insurance to get a transplant. And the reason for that is the organs are scarce. The organ provider groups have to understand that you are able financially and personally to steward that organ, be on your immunosuppressants for life, go to your follow-up appointments so that the organ does not fail in your body. So Medigap insurance is private insurance that someone can purchase that covers that 20%. It keeps people off of state Medicaid. It allows them to retain any wealth that they have accrued through their life. You cannot purchase that right now in North Carolina, or if you can, I think there's another scorecard that's for Medigap specifically, and North Carolina gets a C, meaning one plan is offered, but the premiums are significantly higher for people under 65. So that's important because that gets you on the transplant list, and it's something that I want to work on in the future in North Carolina.
Yeah, and then and Deborah is sharing the Chronic Disease Coalition, which we are also partners with. Their national group as well. They're working on this as well. So this is very helpful for us to understand. I hate that we're starting to run low on time. Mike did have a question about whether the Senate leadership has said anything about the bill. Is it just sort of in its own world, or are there actual?
There's nothing said specifically. I've spoken to the bill sponsor, and he basically said, "I don't know. Just talk to the Senate leadership." So it's one of those situations. It's not been targeted as this bill is, has a problem, and we want to figure out how we get around it. It's just in the large, what I understand to be the large pile, to be blocked.
So then, to be blocked. Oh, nice. So wrapping up then in terms of what we can do, how how do you work with folks? We're grassrooty in the sense
Mhm.
that we're a coalition. How do you work with us? Do you say, okay, contact your legislators about, now it passed the House, so it's actually the Senate.
Yeah, so you would be asking your senators to support H162 when it is in front of them. And I think, grassroots targeting leadership on the Senate side to move a bill is probably not going to be as efficient. I think that's where I'm going to have to expend my energy and figure out what we can say to make this point clear to them. But I think the more people that are supporting the bill, that are talking about the bill on the Senate side, or asking them to mention it to leadership on their own party side, say this bill needs to have a hearing, this bill should be brought forward, and I want to vote for it. We have a grassroots action alert on our website already for this bill from last session, but I need to update it to make sure to be cognizant of the fact that it's already passed the House and we're in a different situation. So once I do that, I'll shoot you that link too, so you can send it to the group if that's something they want to do. But I'd love for this to be a part of any sort of basket of issues that you're bringing forward this session. I think that it's the good, as I sort of sold it before. I think it's nonpartisan, bipartisan. It's been passed in 32 states. There's no opposition, so it makes an easy add to a list of bills that is unlikely to upset the apple cart.
That's great. And I like how you prioritize it. It sounds like you said this is, if I understood you correctly, this is usually the first. Is it so that way you start to get the conversation out, get a sense of who is comfortable, and that's when you start to bring in the more potentially controversial
Right.
or issues?
It's one of the bills that has absolutely no fiscal impact on the state, because that's where the rubber meets the road usually on these bills is what's the fiscal note. Here it's zero. So that's the best part. It actually, and then you could talk about financial savings from people who are able to get transplants versus be on dialysis for their entire life. So it's the easier argument to make, and there's no opposition. That's why we start with that one.
Oh, John, this is fascinating. You have been educating us. I love your work, and we really can't let you go though without, I know it has nothing to do with this, but I'm in stalking you, and you can tell because you have a really nice microphone. What are you off to do right after? And that's not just for your work here. What are you off to do at the end of this interview, just to end this on a fun note?
I am interviewing a beat writer for the Cincinnati football soccer team. I host a podcast that has been on the air for 6 years about soccer in Washington, D.C. So I'm going to go, as soon as I get done talking to you all, I'll go talk to this other person about the game that's coming up for DC United this weekend. So that's my RFK refugees. If for some reason you live in North Carolina and love DC soccer, I encourage you to check it out. It's a fun time.
Oh, your advocation knows no boundaries from healthcare and looking specifically within the kidneys to the soccer world. You are fascinating. John Hoffman from the American Kidney Fund, thank you so much for joining us on Friday Facts. And I will go ahead and I'm going to stop the recording now, but really appreciate everything you've taught us this morning. Thank
Thank
you.
you for having me. And anyone who's on this call, if you have any questions, I'm sure my email it's jhoffman at Kidney Fund, or you
Oh,
can just Google me because apparently all my information is in
you're
the
on
world and you can
LinkedIn
find me
very
there.
easily. And thank you. Before I stop recording, if you want more about the American Kidney Fund, go to kidneyfund.org. It's pretty straightforward.